Hey everyone, so glad you could join me today as we dive into the Child-Pugh Score Unpacking Liver Disease Severity. This amazing tool is super important in the world of hepatology, helping us doctors truly understand and manage chronic liver conditions. I am Docsaab and I can't wait to share all about this crucial topic with you. Let's kick things off with the basics. The Child-Pugh score is basically a grading system doctor used to figure out how serious chronic liver disease, especially cirrhosis. You might also hear it called the Child-Pugh or CTP score or just the child criteria. Its main job is to tell us how well the liver is working, guess what might happen next, help us decide on the best treatments, and even figure out if someone needs a liver transplant. Fun fact, it originally helped predict how risky surgery would be, but now it does so much more. The Child-Pugh score is meticulously constructed from five key components, each offering unique and vital insights into the patient's liver health. Firstly, we examine total bilirubin. This parameter is crucial as it reflects the liver's efficiency in processing and excreting waste products from the bloodstream. Next, we consider serum albumin, a protein exclusively synthesized by the liver. Its levels are a direct indicator of the liver's synthetic function, its ability to produce essential proteins necessary for various bodily functions. Following this, we assess prothrombin time or international normalized ratio, which measures the blood's clotting ability and highlights the liver's role in producing clotting factors. The presence and extent of ascites, which is the abnormal accumulation of fluid in the abdominal cavity, serve as another critical marker, often indicating portal hypertension. And finally, we evaluate hepatic encephalopathy, a serious neurological condition where the brain function is impaired due to the liver's inability to remove toxins from the blood. Each of these five pieces gets a score from 1 to 3 points, 1 being the least severe and 3 being the most. For bilirubin, less than 2 milligrams per deciliter gets 1 point, between 2 and 3 gets 2 points, and anything over 3 gets 3 points. For albumin, values greater than 3.5 grams per deciliter score 1 point, 2.8 to 3.5 scores 2 points, and less than 2.8 scores 3 points. INR values under 1.7 score 1 point, between 1.7 and 2.3 score 2 points, and over 2.3 score 3 points. When it comes to ascites, none means 1 point, a little bit, slight or mild scores 2 points, and a lot, moderate or severe scores 3 points. And for encephalopathy, none scores 1 point, grade 1 to 2 scores 2 points, and grade 3 to 4 scores 3 points. Once we have assigned points to all five parameters, these individual scores are summed up to yield a total score, which can range from a minimum of 5 to maximum of 15. This total score then serves as the basis for classifying the liver disease into one of three distinct Child-Pugh classes. Class A, with a total score of 5 to 6 points, denotes compensated cirrhosis. In this stage, the liver's function is considered relatively good and symptoms might be minimal or manageable. Moving on, Class B, with a score ranging from 7 to 9 points, indicates significantly compromised liver function. Patients in this class often experience more noticeable symptoms and complications. Finally, Class C, with a score of 10 to 15 points, represents decompensated liver function. This signifies severe liver damage, indicating a high risk of serious complications and often a poorer prognosis. The Child-Pugh score carries immense clinical importance across various aspects of patient care. In terms of prognostic assessment, it's a powerful tool for predicting patients' mortality risk and the likelihood of developing severe complications such as life-threatening variceal bleeding. For instance, studies have shown a stark difference in one-year mortality rates, typically 0% for Class A, 20% for Class B, and sobering 55% for Class C. Beyond prognosis, this score is absolutely crucial for treatment planning. It helps guide the intensity of therapeutic interventions and necessitate precise medication dose adjustment, as liver function directly impacts drug metabolism. Understanding its implication for drug metabolism is so essential that it directly informs FDA and EMA guidance on appropriate drug dosing for patients with liver impairment, preventing toxicity or ineffective treatment. Beyond predicting outcomes and guiding medical therapies, the Child-Pugh score is critically important for navigating complex surgical risk stratification. It rigorously helps clinicians determine the safety of various surgical procedures for patients with liver disease. For instance, patient in class B may proceed with surgery but only after careful medical optimization as they inherently face increased risk of complications. For class C patients, however, elective surgery is generally contraindicated altogether due to an high mortality rate associated with such procedures. Finally, the score is absolutely central to liver transplantation decisions. It plays a pivotal role in assessing a patient's eligibility for transplant and perhaps most critically, the urgency of their need for the life saving intervention. In daily medical work, the Child-Pugh score has tons of practical uses. It gives a standard way to assess disease severity in advanced liver disease, keeping things consistent. This standardization also makes communication super clear and easy between healthcare providers, which is vital for teamwork in patient care. We can also use the score for monitoring, watching if liver function gets better or worse over time. And in research, it is go-to for grouping patients in clinical trials and seeing if new treatment actually work. Even though it is super useful, the Child-Pugh score isn't perfect. Assessing ascites and encephalopathy can be a bit subjective, meaning different doctors might score them differently. It also has a ceiling effect, which means its limited score range might not fully show all the ups and downs in liver function. And the impact of cancer on specific parameters can also throw up the total score. Because of these things, other scores like the MELD score are often preferred for deciding who gets a liver transplant, especially since the MELD score is more continuous and objective. So, to sum it all up, the Child-Pugh score is still a cornerstone tool for managing liver disease. It gives us fantastic insight into what to expect and help us craft really effective treatment plans. Knowing all about its parts and how to use it is truly essential for every healthcare professional caring for patients with liver conditions. Thank you so much for listening. If you have any further questions, please don't hesitate to contact me via comments and please like, share and subscribe to the Docsaab's Diary.